Alrighty, so I'm done. Gigi will come remove the rest of the sutures right there. And then Dr. Rodriguez will be in the front after, okay?
Oh my god.
Is it supposed to be this yellow?
Yeah. Yeah, that's just bruising and gross healing shit.
The scars look even. I think it's just the tape that's uneven. And your nips.
Looks so good, y'all. I look really fucking gross.
Yeah.
You look like you're in a lot of pain.
I'm not. It just feels like the tape feels.
Hello, hi. Oh, okay. We're documenting. So I'm gonna remove the bolsters and then the tape. So you'll be able to take a look at everything, and then Dr. Rodriguez will come in and take a few photos. Okay. Are you still on the pain medication?
Not today.
Okay.
I only took it maybe once a day.
Okay, that's good. Yeah, at this point you probably just need it like when it hurts the most, like maybe in the morning or right before you go to sleep.
Usually in the morning.
When I do remove this bolster, just keep in mind that the nipple graft, it's not going to look like it's going to in like a few weeks from now because it's probably going to be a little bit darker. And there's like this overlying tissue that's going to come off. So, and then you'll get the shape of the nipple back because right now it's probably going to be a little bit flatter. Yep. Well, in your case, it's a little lighter, so it's always, obviously it's going to be the opposite of what I say. You can really see the incision down. It's going to look really nicely. And it's more straight, just like we wanted.
This low-key tickles.
Does it?
And I'm not ticklish.
It's probably.
Oh my god.
And it might feel really numb around the incision, and that's just because the nerves were cut. So it takes about 6 months to a year to get that sensation back. Okay.
It tickles so much.
Alright, so everything looks really good. I think you're going to be really happy with how this all heals up. So the biggest thing, so let me just make sure there's not any extra stitches because sometimes we leave tails on purpose. Alright, so I'll let Dr. Rodriguez come in and take a few photos, and then I'll just come back to talk about just the nipple care. It's really simple, so you just have to apply like an antibiotic ointment and then put gauze over, but I'll do it for you so you see what I'm talking about, okay?
Cool.
Alright, she'll be in soon.
Pulling the tape off hurts so bad and it tickled at the same time. Why am I so yellow on my nipple?
It's just the bruising.
It's like really yellow.
Yeah, I know. It's gross, but it'll heal.
I have to wear a binder for longer. I'm gonna cry. She didn't completely cut off my chest hair because there's ones here. And I'm very pleasantly surprised. See? You can tell this one isn't having the best time. With this dip right here. I think it's from the binder too, and because it's really bruised and hard. What if they accidentally swap the nipple sides or on the opposite sides? The one area that's known as this. I can feel here. It just feels weirdish. I can feel here. It's literally doing that to my skin. I can feel it. I'm gonna have feeling in my nipples. Oh my god, I'm gonna have feeling in my nipples.
Congrats!
That's so weird because I can kind of feel it. Now we didn't even fix the rest of my goddamn body.
You
Like,
look
all of
hot.
it.
I'm
I've
so
always looked
happy
pregnant.
for you.
It looks better than expected. But this side is not doing so well. She is like...
Sad.
This side looks good though. It's like... Yes, my armpit hair is white if you're wondering.
Yeah, I was about to say, like, why is your armpit hair
I
like...
can't figure it out. It started turning white like a year and a half ago, and then it turned solid white.
That's pretty punk
And I
rock,
went to a
bro.
doctor, and they're like, "Bitch, you don't have vitiligo, so ask your family if they got white hair early, and none of them really got white hair early, so I think I'm just dying. Oh, he's in here. Perfect. Oh wow, this is really flat. It looks like a pancake.
Very easy. You're gonna wash your hands and apply a little bit of ointment. You can use a Q-tip or you can use your fingers. And then just basically, just to the nipple, okay? That's the only area that you need. Lots of ointment right there. And in order so your t-shirt doesn't get all messed up, you can apply one of these little sponges and just put a single tape, okay? Because tape sometimes make things worse, so you don't need more than that. Just little, so it doesn't mess up your shirt. And then you can put a t-shirt on and then the binder, okay? And let's see, your arms. And remember, so these scars are gonna start nice and thin if you can keep your arms, if you can keep the idea is for your elbows not to go above your shoulders, okay? If it were because of me, I would let your elbows low for a period of 6 months. But I know people have to go back and do work and stuff. If you can get at least for the first 2-3 months, it will allow those scars to stay thin and nice, okay?
Sounds good.
Okay, very good. This is your back, don't forget about it. And we'll touch bases again in a couple of weeks, okay?
Okay, sounds
Okay,
good.
very good.
Yeah.
Any questions for me?
I think that covers it all.
Excellent, thank you for waiting. Thank you so much for waiting, and I'll call you back in 2 weeks, so make sure you make your appointment on the way out, okay?
Okay.
Okay, good to see you guys. Thank you so much.